Hi, welcome to this live special report on the coronavirus COVID-19 from the Washington Post. I'm Libby Casey, joining you from Washington, D.C. Here's the latest news that we're following. The IMF, or the International Monetary Fund, is warning that the coronavirus pandemic is causing the worst economic downturn since the Great Depression. Those $1,200 stimulus relief checks are starting to go to Americans, and the Treasury Secretary says that by tomorrow, 80 million people should get a direct deposit into their bank accounts. And New York Governor Cuomo is warning of a constitutional crisis if President Trump pushes to reopen his state without Cuomo's wishes. And this comes after President Trump asserted yesterday that his authority is total. Now, the question of just who can decide when to reopen the nation is important as we all wonder what happens next and just when the US will return to something like normal. What does that even mean for Americans' health and for our activities and work? We'll talk about that with our guests today. We're going to dig into both what it means economically and also what it means in terms of health. So to start off, joining us, Heather Long, economics correspondent, Felicia Sonmez, national reporter, and Ashley Parker, White House correspondent. Ashley, you are sideways for some reason to us. So let's see if we can get Ashley. I wonder if you can turn your camera, Ashley, so we can get you.
I mean, I can hold it like this. Is this helpful?
Yes. Are you now having to like hold your computer up like that the whole time?
Yeah. But it's just my phone. It's totally fine.
Okay. Thank you, Ashley. Appreciate that flexibility. Hi, Felicia. So good to see you. Thanks so much to both of you for talking with us. And Heather will be joining us in just a moment. Ashley, I know. Hi, Heather. Good to see you. Ashley, President Trump made this assertion yesterday that when somebody is president of the United States, the authority is total. That's gotten a lot of reaction and pushback from governors and other people in local power. How did the president get to that statement yesterday, and what did he mean by it? Do we know?
So we are trying to figure out how he got to it, because as CNN's Caitlin Collins said and pressed him in the briefing, that's not true. The president has a lot of authority, but the president does not have total authority. And this is actually one of the areas. And in previous weeks, I had talked to White House aides who had said the president understands that this is one of the areas where the federal government doesn't necessarily trump what local officials and state officials want to do, what the governor wants to do. So we don't entirely know where he got there. He has in general, over the course of his presidency, expressed a desire for broad powers, especially that first year. He kind of went in and thinking it would be like running a family business where you're the boss, or almost like a monarchy. And he kind of struggled at first with understanding that the president has certain powers, veto power, but he actually has to work with Congress. So again, we don't know where it came from. It is an impulse. I talked to someone today asking, and this person, a former White House aide, said, look, I haven't heard exactly if someone told him that, but some of it is just once Trump says something, if he was, for instance, trying to assert his dominance over the governors, once he says it, especially publicly in that type of combative setting, he's just simply not going to back down.
Felicia, we have seen pushback from Governor Cuomo and others. And of course, some governors are having to walk this tightrope of not angering the president too much because the White House has been, when criticized, less willing to give over medical necessary equipment, less willing to be collaborative and help. But we are seeing governors push back now and say, well, like Governor Cuomo, I have real health concerns and we can't just open just because the president believes that he's got total power to do that. I think you're muted, Felicia. Let's see if we can. There you go. Go ahead.
Thanks. I think you're seeing this play out both on the state level as well as, interestingly, in the race for the White House. Now, we've seen over the past 24 hours, really that moment last night where the president insisted on his, or incorrectly insisted on his authority as president as being total. We've now seen pushback against that from former Vice President Joe Biden, who today tweeted about that, saying that He himself is not running to be king of America, criticizing Trump without naming him, of course. And we're also seeing that from a congressman from Michigan, Justin Amash, who left the Republican Party last year, is now an independent. He's running for re-election to his Michigan House seat, but he tweeted last night while the coronavirus task force briefing was still going on that he disagrees very strongly with this message from the president. He, of course, has very strong libertarian tendencies. He's refused to shut the door to a White House bid over this past year, and he says that he's looking very closely now at a run this week. So these comments from the president last night, as Ashley mentioned, he may believe that these are strengthening his hand when it comes to this delicate dance that's playing out between the White House and the governors when it comes to reopening the economy. The reality is it also has very potent pushback for the president on the political stage, and we're only seeing the beginning of that this week.
Heather, what does it even mean to reopen the economy?
Yeah, I think it's a fascinating political discussion about what role the president has, but the reality is business owners across the country are going to have to make their own decisions. Even if they're told that it's okay to reopen, if they take certain measures, they still have to make that decision for themselves. So that's the reality at the ground level. I think we were all hoping that the economy would just reopen immediately overnight, almost like a light switch. And now pretty much everyone admits that's not going to happen. We are not going to be at 100% anytime soon. The reality is going to be more like opening in phases. And when people do reopen, it's probably going to be opening at more like 50%. There's this talk of every other seat on a plane being filled or every other table at a restaurant being occupied. So there's just it's not going to ramp back up right away as we all would have hoped.
Ashley, even as the president is saying he has total authority, he's also used his daily briefings to throw the responsibility onto governors and to say it's not, for example, up to the federal government to provide items from the national stockpile. And he's pushed the blame to other individuals. So how is the White House talking about and thinking about the actual responsibility right now?
Well, right now, the key, and originally that pushing it to the governors was a deliberate strategy. It was to try to give the governors some ownership of the negative news cycles, right? So the president could say, well, it's your fault, New York, that you don't have the ventilators. It's not the fault of our stockpile, which didn't, have the appropriate PPE. So some of that was intentional. Right now, the thing they are grappling with is what happens on May 1st. They extended the guidelines through the end of April. And they are trying to, as Heather said, reopen the government. And there is a slow recognition that as much as people would just love to flip a switch and have that V-shaped recovery curve and everyone show up back to work on May 1st, that's just not simply going to happen. So the tension is they're trying to balance what public health experts are saying, partially, which is the reason we're seeing, for instance, the flattening of the curve, perhaps in somewhere like New York, is because of these mitigation experts. So you can't, or efforts rather, so you can't just make them disappear all at once, right? And how do you go back to work? One thing I heard they're talking about is break rooms. Break rooms, as it turns out, are high spread areas. You can imagine why. There's people in there that are socializing, they're getting coffee, they're getting food. So let's say you send people back to work. How do you handle a break room? What is appropriate behavior there? Someplace like a bar too, the way people behave there in close quarters, sometimes sharing drinks. What sort of guidance does a bar get for reopening, and what type of precautions does a bar have to take that might be different than a grocery store where people aren't handing around beers and shots? That is what they're trying to figure out, and they don't have any clear answers yet.
Ashley, Kathy wrote in from Michigan and asked, why aren't members of the press corps at the president's briefing wearing masks? So talk to us about what precautions are being taken and how this is being handled.
Sure, that's a great question. I would say some members of the press corps actually are wearing masks. I think actually in yesterday's briefing, you had a reporter who who was wearing a mask and prefaced his question to the president by saying, I hope you can still hear me through my mask. And the president said, barely. But members of the media, in terms of masks specifically, are behaving like members of the general public, which is that the president has and the CDC guidelines have recommended masks, but they are not absolutely required. So I think it's up to the reporters discretion and comfort level. I will say that some news organizations have pulled their reporters entirely from the briefings because of the health risks. And then the precautions that are being taken are, I believe, and I have not been in a briefing room personally since this began, but the reporters' temperatures are taken before they enter the briefing room. The spacing, I don't know how closely she's been following the reader who wrote in and asked this question, but normally the briefing room is incredibly tiny. It looks like a TV set of a briefing room. The reporters sit on top of each other, and if you don't have seats, you cram into the aisles and everyone's packed together. And the White House Correspondents Association, which regulates this, has spread out the seating. So you now see, if you look, when they do those, they cut to the reporters, you see maybe only 1 or 2 reporters per row. That's respecting the social distancing guidelines of being at least 6 feet apart. And those are mainly the 2 key precautions that have been taken. Oh, and one final thing, sorry, is one day they tested everyone who was going into the briefing room. That was in response for someone in the press corps had exhibited symptoms of coronavirus before we knew the results. That one day everyone received one of those quick Abbott Labs coronavirus tests, but that is not the norm. To my understanding, that has only happened once.
Ashley, yesterday's briefing was fascinating for many reasons. President Trump and his team played essentially a promotional or propaganda video of governors praising the president and others praising the president. And he not only snapped at Caitlin Collins of CNN, he also snapped at a CBS correspondent, Paula Reed, who'd asked a question about what the president had done during the time to prepare, that lag time from when he was first taking some actions to when this became a national crisis. And he didn't answer the question, and he was, very, very sort of abrupt and angry at her. How significant was yesterday's briefing? Sometimes when you're watching these, you recognize it's sort of a pivot point or it's an important moment. As you reflected on yesterday's briefing and as you reported on it, how important was it in this moment, this timeline where we're tracking the questions that are being asked, the information that's being shared, and the developments that are taking place?
Sure. So just to give you a sense, I wrote a piece off of yesterday's briefing. I wasn't planning on it, but as we were watching the briefing within about the first, it was a 2.5-hour briefing, basically, I believe 2 hours and 24 minutes. Within the first 30 minutes, my editor sent an email and said, I really think we need to write something off of that briefing. So again, that's human judgment, but I think that gives you the first sense that we did feel that yesterday's briefing felt different, of a different magnitude and order than what we've seen previously. Now, to put it into a context, these briefings have increasingly taken on the feel of the Make America, Keep America Great rallies that the president can't do in the middle of a pandemic. He likes to get up there, he likes to get his fill, he likes to joust with the media, he likes to go off topic, he likes to praise himself, and then he likes to take some questions and then disappear. And sometimes when you watch, it almost feels like there's 2 briefings. There's the Trump show, and then the vice president who runs the task force and the medical experts come on and do the public health portion of the briefing. But just to go into yesterday's briefing, what was so striking, and a lot of this happened at the beginning, was first understand the context. The president steps to the lectern on a day when the death toll in the United States alone ticked up over 23,000. He steps to the lectern during a period where unemployment claims have shot past 16 million. He steps to the lectern in a period where we've all seen, the Post has done great reporting on this, as have others, those photos of cars waiting, to get into food banks, stretching on as far as the eye can see. He steps to the podium where Americans are struggling with knowing, can they pay their mortgage? What's going on with childcare? Maybe they're having some mental health issues. That is the contact, that is the nation he is addressing. And the first thing he does is he calls up Dr. Anthony Fauci for something that feels like a forced apology. Anthony Fauci said something on CNN which implied that had mitigation steps been taken earlier, more lives could have been saved. And Fauci basically says, I in no way meant to imply the president did something wrong. It looked so much like a forced apology that Paula Reed actually asked, Miss Dr. Fauci, are you doing this voluntarily? And he said he was. The next thing, the president plays what you said, that propaganda video. It's a bunch of clips of making the media look bad and Trump loyalists praising him. It feels like a campaign video, but of course it was shown at a taxpayer-funded briefing and done on taxpayer dollars by White House aides. And then the president, if you turned in, his ego and himself was at center stage. It was about him. Who's been nice to him? Who's been mean to him? How he's been brutalized in the media? who's been unfair. And it just did not seem like the response you would expect from a leader in the middle of a crisis like this. And I think that is why it was so jarring to see those behaviors are not necessarily atypical for this president, but in the middle of such suffering, I think that's why we decided to step back and take a broader look, as did a number of other news outlets.
All right, Ashley Parker, White House reporter, thanks so much. We're going to let you go, Ashley.
Thank you.
Felicia, it also seemed to be a bit of a pivot point in terms of politics. And we had this 24-hour cycle where we saw Bernie Sanders endorse Joe Biden. We also saw former President Barack Obama endorse Joe Biden today. And it's not just about the politics, it's also about them talking about coronavirus and their vision for a path forward and what they think the nation is doing right now and should be doing in the future, Felicia.
Absolutely. And I see, just to pivot off something that Ashley was mentioning just now, you're seeing a lot of the pushback to Trump's holding of these briefings coming not only from political figures, but also from within his own administration. Today, Anthony Fauci, the nation's top infectious disease expert, gave an interview to the Associated Press where he acknowledged that he has felt it's been very draining, I think were his words, to get up on the stage with the president day after day for these marathon 2-hour briefings. Judging from the way that the president has reacted previously to comments by Fauci that may have come across as a bit critical, we'll have to see how today's briefing shakes out and whether another semi-forced apology plays out on the stage there. But the repercussions of the president's actions are definitely playing out not only on the political stage, but also within his own administration. Looking to the way that the candidates have reacted to this, one thing I think that's been really interesting is that up until this past week or so, there had been a lot of criticism of former Vice President Biden. Folks were saying that he hadn't been particularly visible on the national stage and in pushing back against the way that the president has been leading during this crisis. And then we've seen in this past day with the video chat that the former vice president and Bernie Sanders held, where Sanders endorsed him, they both really presented this united front where they're calling for Democrats to come together and for the party to elect Joe Biden to lead the country out of this current crisis. So I think we'll probably be seeing more of that in the coming weeks. Frankly, it was something of a surprise that Sanders came around and offered his full-throated endorsement so quickly after leaving the race last week. In the past, we've seen him hold out a bit longer in order to get certain concessions from the eventual nominee, and he made a point of mentioning that last week. But I think the move yesterday really underscores the worry among Democrats right now in the midst of this pandemic and the need that they feel to present a united front against the way the president is handling this.
Heather, as we watch some of the politics of this play out, who ultimately is the president looking to in terms of counsel on matters of the economy and this question of what a reopening looks like, how soon it can happen, if that May 1st is a target date for something realistic or something, unrealistic?
Well, I think we're seeing that he's doing what he normally does, and he's calling a number of business executives that he likes to speak to frequently. A number of conservative groups have also had a lot of access and been some of the largest voices calling on him to reopen the economy. And clearly he wants to. The economy was his big selling point before this pandemic hit for re-election. And we all know he watches the stock market closely and sees that as a sign of whether he's doing a good job or not. While the stocks have rebounded a little bit in April, they're still down 20% from the high in February. So in March, we were down 30%. Now we're down 20%. So we're a little better, but the pain is still there, even by his favorite metric to look at on the economy. I think the hard part for him is if he says, okay, let's reopen, whether it's May 1st or June 1st or whatever date, the worst case scenario for him is we reopen, there is a relapse of cases, and this just goes on and on. Deaths spike again, cases spike again, because already, obviously, there's a fear factor in the economy. People are afraid, they're nervous to go out. It's kind of like when you hear there's a shark in the water and you're at the beach. You're not going to wade back out into the water until you're really certain that shark is gone. And this is sort of what's happening now, that even if we can go back out, some of us in May, I think people are still going to be hesitant. And if they go out, then there's more cases spiking again. Then people really aren't going to want to go out for a long, long time. It's interesting, the head of the St. Louis Federal Reserve, an economist named Jim Bullard, he was one of the first to predict that this was going to be like a Great Depression again in the United States. He did that in early March. People thought he was, too high. Now everybody says the same thing, that we're basically in an economic depression. And here's what he said today, which I found interesting. He said, widespread testing of everybody in the economy would put an end to this crisis and would basically end this whole episode. We can't get there right now, but this is costing us $25 billion a day. So things that didn't seem possible before become possible now. So again, I think another test for Trump is, does he do widespread testing going forward?
Felicia, you had a byline on a story this weekend that reopening the U.S. economy by May 1st may be unrealistic, according to experts, including some even within the administration. I want to say hi to James Homan, real quick, national political reporter. Hi, James. So hi. Felicia, the pushback is coming from inside President Trump's own team as well.
Absolutely. It's, something that we saw on Sunday, which was that official after official went on the Sunday morning news shows and weighed in on this May 1st date that the president has floated internally as a date that he would like to see the economy reopen. Of course, we've seen this happen before. Last month, the president set Easter as the date that he wanted to see the country back in full swing. And as we all know, that was not quite realistic. So on Sunday, you saw the FDA commissioner, Stephen Hahn, come out and say that it simply was too early to say whether May 1st was a realistic date. Anthony Fauci said something similar. He went on the Sunday shows and said that he thinks there will need to be a rolling reentry rather than the flipping of a light switch and the whole country basically comes back online. And as Heather mentioned, logistically speaking, that would just be impossible. So I think, they're taking quite a political risk to come out and be as candid as they have been, these several Trump officials, to bat down that May 1st suggestion. But what they're really showing us is that, as the governors are telling us as well, the situation in the states right now is just not at that point where they can safely reopen. There's a long list of factors that are involved in making that decision to reopen the economy. One of them being the fact that the incubation period for the coronavirus is 14 days. So any state that is contemplating taking that step should be seeing a decrease in the number of newly reported cases, not just over a matter of days, but experts say over a period of at least 2 weeks. So it really has to be that sustained drop. And we're just not seeing that. So as it stands right now, the president says we'll probably hear more this week from the White House on their next target date, but that May 1st date seems less and less realistic.
James, I want to start with you and then go to Heather. This question of what a rolling reopening would look like. Like, what are we even talking about? What does that mean for my life, for your life, for someone who's out of work and searching for a job, for kids who aren't in school right now?
It means, Libby, regional nature, that it would be regional in nature, but it would also be sort of, it's the way Tony Fauci has likened it is it's not flipping a light switch. It's sort of going from from red to yellow to green and kind of like easing up that way. So I think, they could say we're going to keep restaurants and bars closed, but we're going to allow, this to happen. The risk is that, one of the hot spots right now, one of the biggest hot spots in the country is South Dakota, a place that didn't have a stay-at-home order. And so I think that there's a desire to kind of have a regional nature to reopening things, but then all of a sudden you are going to have situations just inevitably as you roll back where 300 workers at a pork plant all of a sudden get it, especially because asymptomatic people can spread the disease. The incubation period is up to 14 days. And, even right now, one of the things, when I was talking to an epidemiologist earlier today, how many people got it over Easter because they kind of did something that they thought was small with just their family. And, now they're not going to know for several days. Is there going to be some kind of spike related to that where we kind of backslide a little bit? And so those are the kind of calculations that the policymakers have to make. And it's all a balancing act. There's no, and part of the problem is there's no right answer. There's not like some optimal answer. It's a judgment call based on balancing how many people are going to die versus, keeping the economy shut down. And like Heather was talking about, kind of careening toward a depression and minimizing the duration of that depression.
Heather, you published a fascinating piece today where you look at what sort of a partial reopen or reopen might look like. And you talk with a driver at the Port of Los Angeles, which is one of the world's busiest ports, about what it's like to sort of be partially working and partially reopen. And he said, weird. Weird was the great lead of this story. What has that been like? What does that look like?
Yeah, so the Port of Los Angeles is usually one of the world's busiest. It was, he told me it was a ghost town when I talked to him in early March. Most of that traffic, those ships are coming from Asia. Obviously, when China and South Korea were hit really hard, and with the coronavirus in February and early March, the factories closed and the shipments stopped. Lately, what we've seen, which is maybe encouraging, is here in April, this driver, Randy Williams, he has gotten a couple of calls a few nights to come back to work because some ships are coming back, but it's not anywhere near 100%. So what are we seeing there? He said everybody finally has a mask. They now have, he starts an hour later at work because they now basically clean the entire place between the early shift and the late shift. One of the problem areas, which reporter Ashley mentioned earlier, is the break room. He said one of the first days back, a couple of people tried to have a pizza party in the break room, and that had to be broken up. And now they have removed all the chairs from the break room to try to prevent people from loitering anywhere. And so there's also fewer workers. I talked to another worker at the Port of Los Angeles. She has not gotten hardly any calls to come back to work. So I think what the number that really scares me is we're supposed to hit 15% unemployment this month. So it's something we haven't seen since the Great Depression. That means even more than 17 million people out of work. But by the end of the year, economists still think the unemployment rate will be close to 10%. So some people will get to go back, but 10%, that's great recession levels. That's 1 in 10 people out of work still by the end of the year. And I think you're seeing that at the Port of Los Angeles, even at one of the busiest hubs in the world. They are nowhere near full volume, nowhere near full number of people, and they've had to totally redo their daily routine.
James, we got a question from Michael, who wrote in from Allentown, New Jersey, asking who is managing the overall U.S. response, and do they have experience in project management and planning and execution? And I want to bring that question in now because all these issues that everyone's talking about and weighing and what a partial reopening might even look like, who's overseeing this on a federal level?
That's part of the problem in theory, the president is overseeing it. The vice president is running the official task force. But now we have a new task force on reopening the economy. And the names of that, it's all White House folks. It leaked out yesterday. It's Jared Kushner and Ivanka Trump, the president's daughter and son-in-law. It's Stephen Mnuchin, the Treasury Secretary, Mark Meadows, the new chief of staff, Wilbur Ross, the Commerce Secretary. And then you have Jared Kushner running his own sort of group with people he's bringing in from the private sector, a lot of people he knew in advance. And then you obviously you have the state governments that are doing their own things, and you have the different compacts that are forming, on the West Coast and the East Coast to make these determinations. That's part of our federal system. A lot of times lately, it's been feeling like the Articles of Confederation more than anything else. But ultimately the decider at the federal government level is the president. And he has approached this with a lot of suspense of stay tuned, as Felicia was saying a minute ago, see what I'm going to say later this week. The president, I think, gets pulled back and forth different directions. Last night, He was asked whether he'd commit to follow the advice of the public health professionals, and he declined to say that. He said, I have to hear what they say, and I have to hear what the economic people say, and ultimately balance that. The previous time that he said that, he backed down under pressure and took the advice of Dr. Fauci and Dr. Birx. So there's a lot of cooks in the kitchen. One of the other things that we reported on in our Sunday newspaper is that even the doctors have their own separate meeting where they're having their own task force meeting separate from the kind of the main task force that meets in the Situation Room, where it's basically the medical professionals that are all trying to get on the same page so that they can present, a unified front against the economic people. And so government's always messy. It's a giant bureaucracy. The Pentagon has its own effort underway, and that's, obviously accounts for a lot of people. But part of the problem is there's this vacuum, and in that vacuum, corporations are kind of stepping up to do their own thing. States are stepping up to do their own thing, and it is one of the problems of the response.
Felicia, before we let you go, what are you going to be watching for in the coming days here as we move forward?
One factor of this that I think is really fascinating is the way that the president has pivoted. We see every day he's trying to cast the blame for the current situation on various actors, from Democrats in Congress, Nancy Pelosi, to China. And I think the China aspect of this is one that's really going to be worth watching and certainly on my radar going forward. In particular, the way that he has been needling the World Health Organization for what he describes as its too soft stance on China. Now we know that the World Health Organization did initially repeat the line from China that there was no known human-to-human transmission of the coronavirus, which it later then revised once there was evidence of that. So the president, I think, is drawing on a lot of the skepticism of the way that the WHO has handled this over the past few months. Now, whether that continues, whether he's just sort of posturing in order to increase US leverage on the global stage, that remains to be seen. And this is a pattern that frequently plays out with the president when it comes to interacting with international organizations. But I do think there are certainly a lot of conservatives in Congress and in outside groups that have been pushing him toward making the World Health Organization a focus of the blame here. And so it'll be interesting to see whether, or I guess the question is really how long he goes down that route, how far he's willing to take it, versus does he pull back? Does he have a phone call with Chinese President Xi Jinping and decide to shift course back again towards the governors or another object of his ire? So that's what I'm going to be watching in this next few days.
All right, Felicia Sonmez, thank you so much. We'll let you go. And Heather, final thoughts for you. I know you got to get back to reporting. Heather, you filed like so many stories over the last 48 hours, including this the story that the stimulus checks are going out to Americans now. So what are you watching for in terms of people getting this money? So important in this headline that people are spending it on food and necessities. That's what we're seeing in the early numbers.
That's right. Perhaps the only good news for the White House is that these checks, these $1,200 checks, 80 million of them have gone out by direct deposit. Some people have already started getting them, and 80 million will have them by Wednesday. That's pretty good. They did that in 2.5 weeks. The last time the government did something like this in 2008, it took 2 months before the first payments went out. So people are desperately need those. The biggest problem for President Trump is this SBA, Small Business Administration loan program, is a mess. He said several times that it's going well and going smoothly. It is not going smoothly. A lot of people, we got 30 million small business owners in the country. Many of them identify as right-leaning or someone on the conservative side, and they need help to avoid bankruptcy right now, and they can't get through. I was talking to a guy in Michigan who voted for Trump. He was caller number 17,000 something when he tried to call the SBA to check up on his emergency grant, not even the SBA loan, the grant, which was supposed to be out before the loans. And the grants haven't even gotten out. So I think this is a real issue for the president. And the same with the unemployment insurance system has been a total disaster in some states, and that are using this technology from the 70s and 80s and cannot process these millions of claims. So thankfully the checks, these $1,200 checks, are getting out, and they're very much needed right now because this other relief is stalled.
All right, Heather, thank you so much. I appreciate your time. James, I want to circle back to a question that Nancy wrote in from Des Moines. Does President Trump or do the state governors have the final authority to lift the bans? I want to bring this all back because, we started off this hour by talking about sort of the battle of the wills that's happening between President Trump and people like Governor Cuomo. But, where does the Constitution, where does American government fall on this?
Well, ultimately, the power really is in the hands of the states. There are some emergency powers that the president has, that have been upheld by courts over time. If you really want to, get into it, where the president, when it's interstate commerce, the federal government has some control. When it's something that's happening within a state, just based on 10th Amendment jurisprudence, it's up to the governors. Where this gets interesting is the president is the nation's. It's supposed to be the nation's moral leader, and set an example. And people follow Trump's example for better and worse. And there was actually some new data that came out yesterday from the CDC about people and who they're taking their cues from. And people are watching what the president says and does. And so when the president floats something about Easter, people listen to that. People are hungry for information. They don't really know who to listen to. A lot of the president's supporters in red states are kind of listening to him. And so one of the challenges is you could have a scenario where states have sort of stay-at-home orders, but really they're recommendations. I mean, they're not locking people up for going outside, and so you could have the president saying we're going to reopen the economy, and people saying, okay, the president said things are reopening. I'm going to work. I'm reopening my business. And meanwhile, the state orders are still in effect. And that would create, it's not a constitutional crisis, but it would create a crisis where there are mixed messages and you could have orders in effect, but people sort of ignoring them, especially the president's supporters. And, this is quickly becoming sort of the latest front in the culture war, which when you step back and think about it is crazy. Like this shouldn't be a culture war. This is something based on science and policy and weighing all those careful considerations that are already complicated enough. But that is one of the concerns that you run into when you chat with these professionals.
Let's welcome our colleague Lena Sundar to the conversation, and national reporter focusing on health. Lena, it's so great to have you with us. Thank you. And we'll get to some of that science and health that James was talking about in just a moment. But I want to share with you that our colleagues on the fact checker team just published a piece just about 5 minutes ago, Sal Rizzo, giving 4 Pinocchios to President Trump's claim that he has total authority over the states. And Sal writes in the lead, this will be a short fact check because the president of the United States is not a king. So that's the Washington Post takeaway with the Pinocchios. Lena, I want to ask you what it will take to reopen the country from a health perspective, because stating the obvious, not a lot changes between now and 2 weeks from now, except that ideally social distancing continues. It's not what President Trump described a couple of weeks ago, that this just sort of waves and washes over America and goes away.
Right.
But if it's still here in the country, what has to change in order to start ramping back up again?
I think what people don't really understand is that if you want to ease up on the gas a little bit, which is completely doable if certain conditions are met. Nobody is saying like, okay, everybody go wild, right? It would be phased. And in the places where there's not so much transmission, where there's not that many cases that would overwhelm hospital capacity, you could sort of phase in some measures. But in order for that to work, you have to have the ability to put on the brakes. And the ability to put on the brakes are people who can then go and say, if there are new cases, let's go find those infected people. Let's ask who all their contacts are. So you had to identify, then isolate the sick person, and quarantine all those contacts. Let's say I've been, you lift up, you allow some measures to take place and people go out, and then you have 10 people who are infected. You immediately have to squash that down. Otherwise, it's just going to cause another explosive outbreak. And that process, that's called contact tracing, and that requires people. You cannot wait until 3 weeks from now to say, okay, let's slowly ease up. And then whoops, what are we going to do when we have new cases? Because if you do not get that under control, you're going to have another explosive outbreak. And so what you see happening is, in the absence of any publicly articulated federal national plan or strategies, states, nonprofits, your think tanks are all out there with these plans saying, here's what we need to do to hire up. Also, we have 10 million unemployed people, right? You have also states who have been forced to lay off employees because of furloughs, because the tax filing has been moved to July 15th, so they don't have the revenue. These are not rocket scientists that you would have to hire. These are people who would call you up and say, hey, James, you're testing positive. Who else did you talk to yesterday? Who did you see? What are their names? We got to call them up. They could be exposed. It's a very, very time-intensive, labor-intensive process, and you need people. Some states have started to do that, but there needs to be guidance and framework and policies about this, and we don't see that coming from the national level.
Lena, you make so many important points, including that testing has to happen, and then contact tracing can happen, because if we don't know that James is positive, we don't want to go to all the effort to tracing everyone he's got if we don't really know if he's sick or not. And you also point out that this can be done over the phone. So if people are contact tracing, it's not a door-to-door operation. It can be done over the phone. It can be done using the computer, and it can be a way to employ people. James, we have a question that came in from Misha in New York, who asks, what does the end of this phase of the coronavirus look like? Misha's asking, are we talking about testing access? Are we talking about seeing new confirmed cases dip below a certain number, or is it going to take like a vaccine to get to the end of this phase?
It's really going to take a vaccine to get to the very end. And that was, yesterday, Andrew Cuomo was saying, we think we have the worst behind us in New York. We're going to start to ease up. We're going to start to slowly let life return to normal, but life is not going to return to normal until we have a vaccine. And the best estimates are still that that's going to take 12 to 18 months. And so, my favorite day of the year is going to the Minnesota State Fair over Labor Day weekend. And, that feels like such a long time from now. And local officials in my home state of Minnesota have said it's too early to say, but, it's very hard to imagine that the fair is going to look anything like it ever has before, where you have literally the entire state comes, and is tightly packed together because there's not going to be a vaccine. And something like that could end up being, a big spread. There was a study that came out today about how it was actually lives were saved in San Francisco because the 49ers blew their lead in the Super Bowl. And so if the 49ers had won the Super Bowl and they would have had a victory parade and celebration in San Francisco, there would have been a huge spike in the number of cases and people would have died as a result of that. And so until there's a vaccine, you still need the social distancing. You still, because we're not going to get up to kind of herd immunization, herd immunity, where 60, 70% of people have had it and therefore it doesn't really spread as much. And so that's one of the challenges. And that's why inevitably, if you don't have a vaccine, if you let up the gas, you're going to have a second outbreak. It's what happened in 1918. It's what happened with other pandemics. In some places in the United States in 1918, the second wave was deadlier than the first wave. And, the policymakers are very cognizant of that. And it's an unfortunate reality because it would be wonderful to say, if we just all do this right at the end of April, it'll be over. But it's just not the case. And people kind of have to gird themselves accordingly.
Christine wrote in and asked, what are the obstacles to large-scale testing? She's comparing and contrasting the US with Germany. So Lena, where are we at with testing? We heard the president at the briefing talk yesterday again about how everyone has what they need, basically, at this point.
The president has been totally economical with the truth on testing. And I believe that would be the British way to say it. The testing has not ramped up because some of the commercial places have not scaled up, and a lot of it is very wonky, in the weeds kind of thing. But I wanted to address something you had said earlier. So it's not a sequence, not testing, then contact tracing, then
Great. Yeah.
others.
Yeah.
You got to start hiring those people now, because testing will come up, and in order to hire these people, there are some estimates that you would need 300,000 people. Just to give you for instance, in the city of Wuhan in China, the epicenter, 11 million people. They had teams, there were 1,800 teams of 5 people each. That's 9,000 people who are doing contact tracing. Contact tracing in the old days, like during West Africa, during the Ebola outbreak, that was door to door. Here, because you don't want to spread, it is all done remotely, right? On the phone, call centers, and it can be done very, it takes time, but there are now some use of technology apps, contact tracing apps, where they can sort of maybe pull down your contacts depending on your proximity. I think those raise some civil liberties questions, and I know the White House is very not into that. But I think what public health folks are trying to raise is this larger issue of, we need to start addressing the pieces. Everybody wants to reopen, and what are the things that have to be put in place, and what are the resources? Does Congress have to give them more money? Like, what is the plan?
Mm-hmm. How many tests would be needed? What are we talking about in terms of test necessity?
Capacity? I think on order of magnitude 10 times more than what's going on here. And there's different kinds of tests, right? Right now, the problem is with the diagnostic tests to determine whether you have COVID, and it looks for genetic pieces of the virus. The other kind of testing they're talking about is to see, now that we're 3 months into the pandemic, do some people have immunity? Do some people have the disease-fighting antibodies in their system? Because the feeling is that if you have enough of those antibodies and you have some immunity, then you are the kinds of people you can go back to work, right? Especially if you're an essential worker on the healthcare front line. So the tricky part of that is there are lots of bad tests out there on the market that return false positive for those kinds of tests your blood. And it is a sort of a look back kind of test to see what % of Americans were infected. Maybe I already had COVID, I was completely asymptomatic, and I completely recovered. That would give you some sense of what kind of workforce could safely really go out and go back to work.
So Lena, who are emerging as the leaders? I mean, you reported that there are some plans sort of finally emerging to fight coronavirus. It's not coming though from the White House. So you talked about efforts by nonprofits and efforts at the statewide level. Who is taking the lead?
Among the states, Massachusetts has developed its own plan to hire 1,000 contact tracers and to do this work that we've been talking about. And Massachusetts has the benefit of working with Partners in Health, which is a big nonprofit that have done a lot of this kind of work in Haiti and in Africa. It's the same sort of basic thing. And I think last week when we talked to them, they had already hired 150 people. And the feeling we got is there are people who are sitting at home, they want to be productive, they want to help, and you can be trained up to do this. The Association of State and Health, State and Territorial Officials, State Health Group, has also partnered with Johns Hopkins Center for Health Security. They have a detailed 16-page plan that would involve hiring an additional 100,000 people, how to train them up, how much it would cost, like $3.6 billion. But you also have to think those people that would be a way to boost the economy too. And then there are some, and we have the Peace Corps. Peace Corps is all brought back, 7,000 people. They've been certainly trained up to do certain things and skill sets. They could be easily trained up, work under FEMA. So and Scott Gottlieb has a plan, Center for American Progress has a plan. You have plans coming from both the left and the right, and they all have the same common elements, which I think goes to tell you people agree what has to be done.
All right, Lena Sundar, we're going to let you go. Thank you so much for talking with us this afternoon.
Thank you. Pleasure to be here.
James, important to point out that the Massachusetts governor is a Republican. So it's not all Democrats versus Republicans, sort of along sort of strict party lines. But you mentioned earlier that South Dakota is having a crisis moment, and their Republican governor has been really resistant to calling for social distancing and asking her citizens to stay home.
She hasn't just been resistant, she's actively disparaged the idea that she'd do it. And what's amazing is there's a petition now that has 1,500 signatures from South Dakotans, including the Republican mayors of the biggest cities in the state, Sioux Falls, Rapid City, Republican conservative doctors saying, look, this isn't about individual liberty. This is about, the community coming together. And she has continued to resist it. Yesterday, she had a news conference and the local reporters were pressing her. And she instead was talking about doing a hydroxychloroquine study with a limited number of people, and how she had a conversation with Jared Kushner and how the White House returns her calls. And so the local press has been very critical. She has held firm. 5 governors continue to hold firm on not bending here. One of the things, Sioux City, the biggest city in Sioux Falls, the biggest city in South Dakota, the mayor has put in place all sorts of recommendations, but the problem is there's all these suburbs around it that don't have those recommendations in place, and they're not enforceable. And so he's kind of very upset because there's this outbreak. So 300 people at the Smithfield pork plant got it, but 900 people in this city, making it one of the biggest hotspots in the country. 900 people have it. 8 people have died. More are going to die. And South Dakota doesn't have a huge supply of ventilators, all those different things. And so it's interesting because for a lot of these governors, this is their legacy. This is like the biggest kind of litmus test. And interestingly, Charlie Baker's a unique kind of Republican. He actually used to run the Harvard healthcare system, the outside their kind of Harvard hospitals. And he actually was Mitt Romney's health secretary when Romney was governor. He was the health secretary. Trump actually attacked him the other day during one of these news conferences as a rhino, a Republican in name only. He has a huge, super high approval rating in a very blue state. But he's a conservative, and this is kind of one of those things where he's very much of that old school Republican. Trust the experts, trust the doctors. And it is, like I said, it's amazing how this has become a culture war and a culture clash. And it wouldn't have been that way in the not distant past. And it really is, even you saw a bunch of the governors that had been holding out on these stay-at-home orders, Libby, sort of change their tune when the president every day blurs together. I don't remember if it was a week ago or 2 weeks ago, when the president all of a sudden started taking it seriously and said, this is really bad. 2 million people could die. I believe it was 2 weeks ago now. That's what prompted a lot of the kind of the holdout governors like Ron DeSantis in Florida to say, okay, we're going to start putting these things in place. And it is because they're, like I mentioned, the CDC guidance, but politicians are also following the lead of the president. They don't want to get crosswise with him. So just as I mentioned, if Trump says, let's open everything up, people will do that. If Trump says we've got to keep it shut down into May, people will follow that cue. It cuts both ways.
You had a really interesting Daily 202 look at South Korea and comparing and contrasting South Korea versus the US, and also with a bit of a warning about opening up too soon.
Yeah, so South Korea has done 3 times as many tests per capita as we have. A lot of what they are really good at contact tracing. And some of they do a lot of stuff that we wouldn't really tolerate as a free and open society, even though they are a democracy. They're really, kind of invasive about tracking people's phones and tracking people down. But they have apps where you can see people who've been infected by the coronavirus, where exactly they've been and when. They also, the government and corporations are really close in South Korea. It kind of dates to the Cold War and when they industrialized. And so the US and South Korea both detected their first known case of coronavirus on the very same day. And immediately the South Korean government brought in their private businesses and said, look, we need to ramp up testing. And so there's kind of this public-private partnership. But to your point, they've reopened some bars and restaurants. They've had some problems there. Daegu, one of the cities in South Korea, has had a very potent outbreak, and it's been tied to kind of a fundamentalist religious sect where the worshipers believe that the leader of the church is God and is immortal, and that's where a lot of the outbreak really exploded, and that continues to be the big hotspot in that country. So the government has kind of taken extraordinary measures to pull that apart. But anyway, the South Korea story, when you look at their curve versus our curve, it really is amazing. And they have flattened the curve, every day. They're seeing fewer and fewer cases. That trend has continued now for a couple of weeks. And there's definitely a lot we can learn. Different systems, obviously, but a lot we can learn.
What states are you watching? Of course, you mentioned, we talked about Charlie Baker in Massachusetts. Larry Hogan's another one of those Republicans who is in a state that's purple to blue and is not necessarily holding to sort of some of the social ideological directions the president's going. But where else are you watching right now, James?
So yeah, every state's interesting, of course, but one of what I wrote about today was there's really 6 states that are going to decide the 2020 presidential election, and those 6 states, everything has changed. It feels like life's been turned upside down over the last 30 days, but it's the same 6 states that are going to determine who wins in November. I'm a national political reporter, so I do pay attention to politics, and so the 2 that I think are really significant from a 2020 perspective are Michigan and Pennsylvania. Michigan has become a hotspot. A lot of wild stuff's happening in Michigan. The governor there, who is rumored to be someone Joe Biden's looking at, Gretchen Whitmer, as a potential running mate. So that is kind of drawing more scrutiny. She's taken very aggressive action now in terms of restricting what stores can sell, enforcing the stay-at-home orders. That's actually led to growing pushback from Republican lawmakers in her legislature. And so there's a lot of tension there. And then the hotspots in Michigan are in the urban centers like Detroit. And so there's a couple things going on. One, the public transit workers, Detroit's, obviously inner city Detroit, very poor. The vast majority of people depend on public transit, don't even have cars, but a huge number of Metro transit workers in Detroit have gotten sick. One of them died after recording a viral video where he was complaining about someone kind of like coughing on him and how he he was working, and he ended up dying a few weeks later. And so there's a lot of transit workers who don't want to work, but they have to work to keep the economy going. And then the other tension is Michigan's right on the border with Canada. So there are actually thousands of nurses who live in Ontario and commute over to Michigan and work in the Michigan healthcare system. And so Canada, even though the First Lady of Canada, Justin Trudeau's wife, has the coronavirus, they actually have had very few deaths. They have far fewer cases per capita than we do. And so there's a big push underway in Ontario to prevent these nurses from coming back and forth every day because there's a fear that they'll spread it into Canada. And so there's 1,600 nurses who work in kind of Detroit area hospitals who are going to have to decide what to do. Are they going to stay home? That could lead to huge shortages in some of those Michigan hospital systems. Michigan also on the front line of the antibody testing. The biggest healthcare system in that state is testing all of their employees, the nurses, the doctors, the workers, 38,000 people all told. And they're trying to do antibody testing, which is another kind of key part of the process of reopening. And other places in Michigan are doing serology tests, which is to take the blood of people who have had the disease. Anyway, so a lot of really interesting stuff is going on in Michigan. There's a lot, it's in some ways it's a microcosm of the country, and it's going to be, the president really narrowly won it in 2016. So I'm paying a lot of attention to Michigan. It was also the last state I visited for work, right, the day before the Michigan primary, before everything shut down. So I often think of, the last campaign rallies that Biden and Bernie Sanders had were in Detroit. And it really had kind of blow up as a hotspot, not because of that, but it's going to be a really important state in the fall, and I think it's very ripe politically for all those factors.
When we talk about reopening this country reopening on both a local level as well as a global level, there's a real difference between rural America and urban America right now, both in terms of how real coronavirus feels, what the immediate future holds, the next week, 2 week, 3 weeks in urban centers. What are you hearing, James, from local leaders in rural America in terms of what they're watching and how connected or disconnected they're feeling about this?
Yeah, so my mom lives in rural Minnesota, and I talk to a lot of my friends live in rural areas, and so it is a very different experience for them. I think it's become more real in the last week. It's not just, it doesn't feel like a New York City thing as much, but they're feeling more of the economic impact than the health impact, and so that's what, they're still shut down, they're still furloughing, they're feeling the financial brunt as much as people in the East are, if not more, actually. And they're finding it harder to get capital in rural areas. The banks haven't been as free about giving money to the rural areas as the suburban and urban areas. And so there is definitely tension there. The other tension is you're seeing a lot of stories around the country where rural areas really don't want people from urban areas sort of showing up. Normally they're welcome because they bring money and buy goods and everything, but there's a lot of fear in the country, unfortunately, understandably to some degree. If someone shows up with a New York license plate in rural America, they're not going to receive a warm welcome right now, and so that's one of the kind of the tension points that I think you might see more of is kind of people flee the cities, kind of going to their second homes or renting houses out in the country. That's part of the tension.
All right. And before we let you go, what are you going to be watching over the next couple of days as we see, this economic council come together that the president is been talking about, and as we watch the counts in places like New York, Detroit, Washington, D.C., what's on your mind?
Yeah, I mean, I'm paying really close attention. Deaths, unfortunately, deaths are a lagging indicator. So what I pay super close attention to, obviously on our website, every death is horrifying and the stories are just heart-wrenching.
And there have been incredible profiles. I'll say, if you haven't taken the time to read the Washington Post profiles of people who've died, it's very powerful, and it takes it from sort of the big picture to the very personal.
Yeah.
And they're working hard to trace all those people and get their personal stories.
And so those are, and we're going to continue to do that. What I obsessively pay attention to every day are hospitalization numbers and confirmed cases. The confirmed cases is a reflection of testing, in some ways more than kind of the reality of who's sick. There's obviously a ton of people who have the coronavirus who have not tested positive for it, but to the point that, people need hospitalization. Fortunately, we're under projections in a lot of places. Here in DC, Mayor Muriel Bowser said we're not likely to see our peak demand on hospitals until mid-June, which is kind of, something as we talk about opening the economy on May 1st here in the nation's capital, the mayor's saying we're not going to see the peak until, a month and a half after that. Anyway, I'm watching the hospitalization numbers because that's sort of telling us whether we're flattening the curve, whether the social distancing is working. And it also is, that's how you know where the next hotspots are going to be. Is who's getting hospitalized. So that's what I'm paying the kind of the closest attention to below the top line number.
All right. James Hohmann, national political reporter and author of the Daily 202. He also has a daily podcast. James, thank you so much for taking the time to talk with us.
Thank you. My pleasure.
And thank you for watching this Washington Post special report on COVID-19. We'll be back again on Thursday at 3:00 Eastern time with more guests from the Washington Post newsroom, talking about the latest headlines and the latest stories about this crisis situation here in the United States and, of course, around the globe. A reminder that we did hear from our colleagues today that these stimulus checks are going out right now, but there are warnings globally from groups including the International Monetary Fund about just economically what this may mean in the coming weeks and months. I'm Libby Casey. Thank you so much for watching. I'll see you on Thursday.